Hello, doctor.
Hello.
Today we'll be answering some common questions from our patients about tipplasty. What is tipplasty and how is it different from rhinoplasty?
So a tipplasty is essentially the modification or the remodeling or the aesthetic rebeautification of the tip of the nose. So the major difference between a tipplasty and a rhinoplasty is that once we perform a rhinoplasty, we do modifications to the bony part of the nose. So the nasal bone, the sutures between the nasal bone and the cartilage are also manipulated during a rhinoplasty. Whereas in a tipplasty, all we do is we kind of remodify this portion here of the nose.
Who is a good candidate for tipplasty?
So anybody who actually has a problem with the tip of the nose are candidates for tipplasty. I mean, it's not really, one person is a candidate for tipplasty and not rhinoplasty or vice versa. It's all about how the patient feels about their nose. In some instances, we do see patients with a straight nasal dorsum, not too wide, looking good in the middle, no deviation to the right or the left. However, they do have a very droopy tip. This may also impact breathing as well. So that might be, I'm not going to call it an indication, but that might be one of the patients who would benefit, who would definitely benefit from a tipplasty. But at the end of the line, it's all about how the patient feels. I don't believe a patient who's unhappy with their tip should actually feel as if they have to get their whole nose worked upon just to get a better aesthetic result. So I don't think there's like a specific type of person, but essentially speaking, anyone who's uncomfortable with the tip of their nose and doesn't want any modifications or any work done on the nasal bones is a candidate for tipplasty.
How long does the tipplasty procedure usually take?
The surgery obviously differs from person to person, but it's shorter than a rhinoplasty, obviously, because we're not actually manipulating the nasal bones. However, I would say that it lasts anywhere between an hour and 2 hours, so probably approximately an hour and a half.
Is the procedure performed under local or general anesthesia?
Okay, good question. So it is possible, it's not impossible to actually perform it locally, but we do prefer to do it under general anesthesia or sedation, only because it creates a more comfortable environment for the patient. However, if there are contraindications to general anesthesia or the patient's willing to go through it locally, then it can be performed under local anesthesia as well.
What is the recovery process like? Are there bruising or swelling?
So you're not going to see as much swelling or as much bruising as after a rhinoplasty, because during a rhinoplasty, we do have to make small incisions in the bone to kind of shift the bones as well. That's an additive factor to bruising and ecchymosis. So you're not going to see that much ecchymosis and swelling. However, you will see some swelling around the tip of the nose. You might see some bruising on the skin above that nose. But I do believe that even after rhinoplasty, one of the most persistent edemators, or one of the most persistent spots where edema lasts for much longer, is actually the tip of the nose. So even if we do a rhinoplasty or if it's just a tipplasty, I do believe it will take anywhere from about 6 months to a year for that edema to completely subside and the real shape of the tip of the nose to come into aspect.
Is tipplasty purely cosmetic, or can it help with breathing problems?
Again, a very good question. I do believe that lifting the tip of the nose, especially if it's extremely droopy, like a nose that actually hangs downward, obviously lifting that up opens the nasal passages more and helps in breathing. However, how many noses do we actually see who want tipplasty that are that droopy? I wouldn't say too many. So in my experience, I'd say it's about an 80% aesthetic and a 20% functional surgery.
Is tipplasty sufficient for patients with nasal tip drooping?
if that's their only problem, if that's the only problem that they feel is making them unhappy or creating an unaesthetic look, then yes, why not? I mean, it's not, like I said, I don't feel people should feel the need to get a full rhinoplasty just because they're unhappy with the tip of their nose. So if it is just the droopiness that's causing them problems, or if it is just like the shape of the tip that is actually the problem, then yeah, why not? Just do a tip plasty and get it over and done with.
Can someone who has already had rhinoplasty undergo tip plasty?
Of course, yes. I mean, that's a revision tip plasty because nobody's going to do a rhinoplasty without actually modifying the tip as well. So if the patient has undergone a rhinoplasty before and if the expectations for the tip aren't fully met, or the person is unhappy with the tip of the nose, then doing a revision tip plasty is just fine.